Hello, my name is Kirk Fisher, and I am going to be discussing electronic medical records, the implementation, the design, and the use. Throughout this presentation, I will review the need for electronic medical records, go over the planning phase for the implementation, the design, what happens at go live, what you need to support you, and the use of electronic medical records, also known as EMR. So the days of paper charting, you had illegible writing. Medical errors occurred due to not being able to read what physicians put, and it also led to time spent clarifying with doctors what it was they wanted exactly, since you couldn't read it. It was also difficult to locate your patient history, hard to transfer the data from one facility to the next, could take a lot of time, and the medical records take up storage space. You have to keep them locked up for years after, and but there's potential they could be destroyed by a fire or some natural disaster. So advantages of EMR include reduced medical errors. They're transferable from facility to another. I know, like Mercy, you can transfer to another tri-health organization or similar hospital system with patient's permission and click of a button. And you have immediate access to information in the patient's chart. You can see their history, allergies, any problems they've had, with healthcare in the past and compliance issues or whatnot. One medical record per, healthcare organization. So I know, like a Mercy facility, you have one chart for your hospital stay that'll show any outpatient stays, primary care physician notes, any testing that you've had within Mercy. And you can also run reports with the EMR, try to document volume if you want to look at how long certain things take, and you can do some data mining to improve your workflows and try to really narrow down what's working and what's not. Disadvantages include the initial investment. It's extremely expensive, and there's ongoing support costs. There's possible data breach, security breaches where personal health information can be compromised. The implementation phase is extremely stressful and can lower staff morale. And some staff are slow typers and takes longer to enter data, and so that data entry time increases versus just writing on a paper chart. Also, when you're writing with the paper chart, you can kind of be with the patient holding the chart, and they feel like it's more personal. So you turn around the computer, documenting on a workstation, it can reduce your personal touch and that connection with the patient, and they might think you're ignoring them. So planning for conversion, you have to look at your business needs and your technical needs, and really analyze what's needed in both areas. Develop your work project plan. You got to put together a scope of work, preparation, put together a budget, and really agree on the funding for your EMR conversion. You also have to migrate data and transfer anything you can. Document your current workflows and see where those could improve with the EMR. You also have to order network services, adjust infrastructure as needed to fit the hardware. Data drops, cables, make sure there's enough equipment, enough areas for workstation, and the workstations are deployed in areas where they're needed. So to design, you have to include the key stakeholders: nurses, physicians, techs, radiologists, anybody who's going to be using this, and you want to make it so it's definitely usable and improves their workflow versus makes it worse. Makes the things its capabilities so it's easier to do them right than not do them at all. So there's capabilities within the EMR that make it safer, but you don't want to make it so it takes more time to implement the capabilities. There's pop-ups available, but you want to avoid using too many pop-ups. Alert fatigue is real. If they see too many alerts, they'll start to ignore them. So make sure you have the right amount. You also want to make it visually appealing. It's got to be easy on the eyes in order to, for them to actually appreciate it and know where everything is correctly. So during implementation, you put together an implementation team, of course. You'll analyze your workflow and redesign. Just think about how your workflow is going to be changed with the EMR, and modify your facility as needed to fit the workstations, the hardware, and get the installation of the hardware installed. Make sure the security on the EMR is adequate, so there's not any data breaches. You have to manage your your testing areas and make sure like lab and imaging can flow into your main EMR system, and of course configure software the way your key stakeholders think it'll best fit their job. Also, create interface to communicate with other systems. There's many modalities within testing areas other than your main EMR, and they have to be able to communicate. Also, building templates is key to improving efficiency. Commonly used phrases you can use smart phrases for, and you can do templates such as order sets. Commonly used orders that for certain disease processes will speed up patient care, and you can put best practices in there. So you're doing the latest evidence-based practice, and all the physicians have to do is follow the order sets and just make adjustments that are patient-specific. You also need a backup system for any downtime, any possible power outage. Of course, facilities have generators, but internet servers can crash, and just make sure you have a mechanism to document and provide safe patient care during downtime. And if you can load any existing data from the paper medical record, go ahead and do that too during the implementation. So go live is extremely stressful. I've been through a couple. You need thorough training, lots of class time, lots of practice time. Identify your super users, the people that are more computer savvy that can be there to support the staff even after the extra support staff is gone. You want to ensure there's adequate IT specialists, EMR specialists during the go live, and do it on a day where volume is usually lighter. So you also want to be able to change it quickly as you discover changes. So you have to be able to give feedback on workflow issues and aspects of the EMR that aren't conducive to improving the workflow, but actually make it worse. Or sometimes the people who develop these, the implementers, might not think of something the nurses or the frontline staff will think of post go live. So initially, you're going to have high productivity, low patient satisfaction, low morale, and the staff will resent the change. Most of them anyway. But within a couple months, hopefully they'll see the benefits from the EMR. They'll get more comfortable, and you'll recognize your return on investment. Support, you got to have plenty of IS specialists on site during initial go live, and then at least 2 weeks on site, and they have to be available at the drop of a hat. Usually they put a couple in every unit. And then the command center, it's open 24 hours. They're available by phone. They can remote in, and if they need to, if they can send somebody on site. And how the specialists help build your templates while they're there to format it the way that fits your needs. So by using EMR, it leads to better healthcare. Improves the safety, improves the effectiveness, improves communication, patient education, and efficiency of healthcare provided. So I know there's only a few in this class that are in healthcare, so try to think of some questions that everybody could chime in on. But has anyone had an experience with electronic medical records? Even something like my chart. Well, I have an app on my phone where I can view appointment times and lab results and whatnot. So without EMR, my chart would not be possible, of course. Has anyone used something similar to that? Now, and now that we're mostly transitioned, at least in the United States, to electronic records, can you even imagine a world where paper charting existed? I know I can't. Look forward to hearing your answers to these questions and discussing this throughout the week. Here's my references. Thank you for watching. Goodbye.